Hi, and welcome to the ComSpark Magazine interview series. I am Catherine Bashan with Vernovus, and we are partnering with ComSpark Magazine on a series of interviews. And today I have the pleasure of speaking with Andy Lehman, the Chief Information Officer for Kettering Health. Thanks for joining us, Andy.
Hi, Catherine. Thanks for having me.
Hi, great. Thanks for joining.
Sure.
So I guess let's go ahead and get this started off by you telling us how you got into the technology field initially.
That's kind of an interesting question in some ways. I was a chemistry major in college, and maybe for anyone who has a degree that they're not sure what to do with, just know that there's hope. You may ultimately end up in a really good place, because I'm not using much of that chemistry degree anymore, that's for sure. But my first job out of school, which is getting farther and farther in the rearview mirror, was in IT, and they had a good training program, and it was with a company called EDS. And that really got me started down the track. But I'll tell you, if you had told me when I got started that I would ultimately be a CIO for a healthcare company, I would have said, you are out of your mind. I've done some different things in my background, so I didn't start out in healthcare by any stretch. I've had my own companies. I had a consulting gig with Kettering Health, which ultimately led to me being hired by Kettering Health, which ultimately led to me becoming the CIO. But there was no sort of traditional start at the technical level within a IT organization and a healthcare organization and sort of work your way up. I sort of came in from a whole different trajectory, so to speak. So.
Sure. Well, I believe Kettering Health has about 13 area hospitals across Dayton and the Cincinnati area, with about 120 outpatient facilities. Can you tell us a little bit more about your role as the CIO of Kettering Health and what your main focus is?
Yeah, sure. So I feel really fortunate that I do or get involved in any number of things across the network from a strategic perspective. So I'm not really confined to just the world of IT, if you will, inside Kettering Health. So I certainly have responsibility for what you would consider the traditional IT function. The data centers and the networking and the support service organizations, as well as all the applications and the portfolio of applications and all those development teams. But in addition to that, I have responsibility for the project management office, and then also the analytics and medical informatics functions within the organization. So strictly in terms of sort of my span of control, it's more than just traditional IT, which maybe is not too unique for CIOs. But what's, I think, really great about my job is I have responsibility for one of Kettering's strategies, for example, the access strategy. So we're doing a lot of really great things around transforming how people engage with Kettering Health. Obviously, there's a strong digital component of that. But as CIO, it's pretty fun to actually lead out on one of the strategic initiatives. And then I'm typically involved in all other strategic initiatives as well. So my role goes way beyond just sort of, I think, the traditional CIO. And as mentioned, I feel really lucky for that, because I enjoy that tremendously. And I also have a great leadership team who I work with that really allows me to do that. So.
Sure. That's great. Well, I know everyone's always interested in hearing everyone's career paths into a tech leadership role. And it's kind of funny how everyone finds their way into tech throughout their career. Sure. And again, as you mentioned, your career path progressed differently. You have those entrepreneurial traits as well. Tell us a little bit more about your story and as you grew up through Kettering.
So as mentioned, I started with Kettering when we were building a new hospital, and I was consulting on that project. And then after that hospital was completed and opened, I got involved with helping the CIO at that time develop the strategic plan for information systems. And then as we worked through that, I was asked to come on board with Kettering. And when that CIO left, they asked me to become the CIO. So as mentioned, I didn't spend a lot of time sort of coming up through maybe sort of one of the core technical teams or a support services team.
Sure.
Very much came in from sort of the side, if you will.
Mm-hmm.
And I think you alluded to this a minute ago. I think diversity of thought is a great thing. And I would like to think that the experience that I had in my past around having my own companies and not necessarily growing up through healthcare allowed me to look at things with fresh eyes and hopefully be a real catalyst for change in a good way. So I think my path, although unique to me, it may not be unique to others, or
Sure.
hopefully maybe some of the listeners of this, it gives them hope that you don't necessarily have to start a certain way to ultimately arrive at the place you want to be. So.
Sure. And that's great. And I think a lot of people certainly need to hear that, especially if you're interested in the technology field. There's so many different avenues that you can go.